Welcome back to the Mastering Miles podcast. My name is Matt Ferlindis. I am a physical therapist in the Milwaukee area that specializes in treating runners and running injuries. Today on the show, we have Dr. Zach Shiels with Elite Sport and Spine in Brookfield, Wisconsin. Dr. Zach Shiels is a chiropractor as well as an expert in runners, and today we are going to be chatting about and diving into proper running assessment. What all goes into a proper running assessment and what we're kind of looking for in runners. We especially talk about functional movements in terms of like squatting, breathing, core, and then we dive a little bit further into actual running itself and the big Texas size findings, as Dr. Zach Shiels calls it, that we're looking out for in runners. Ultimately, we really hope that this conversation allows runners to realize that there's a lot more that goes into a running form than just simply how we run. And in this episode, we're going to try to educate and explain how that works a little bit more. As always, if you are enjoying the show, please subscribe, follow along, and leave us a review on Spotify and Apple Podcasts. I would greatly appreciate it. But let's go ahead and get into our conversation with Dr. Zach Shiels on proper running assessment. Well, welcome to the podcast today, Dr. Zach Shiels. Thank you so much for coming on. If you want to go ahead before we get rolling here and just kind of introduce yourself to everyone, that would be great.
Yeah, thank you for having me, Matt. Thanks for this opportunity. I'm really excited about it. As you said, I'm Dr. Zach Shiels. I'm a sports chiropractor at Elite Sport and Spine in Waukesha. I own the practice. We've been in business for 10 years now. Started in March of 2014. So next month, when the podcast airs, it'll be 10 years. So that's kind of an exciting milestone to hit. But yeah, I'm really excited to discuss some running assessment stuff with you today.
Cool. Well, congratulations on 10 years. That's, like you said, that's a really cool milestone. So congratulations on that.
Yeah, thank you.
And I know you have a really keen interest in treating runners, and you treat a lot of runners. You see a lot of runners. You are a runner yourself, so you're very invested in running and making sure that running is as optimal as possible. And on the podcast, we've been chatting a lot about running form, optimal running form, whether it actually exists or not, and different things like that. So I'm excited to kind of dive into more of what goes into a running assessment overall. I feel like that phrase gets thrown around a lot overall, and there isn't like a standardized approach to it. And so I'm excited to kind of go through those details with you, but just kind of get the ball rolling here in terms of like running assessment. What does that mean to you overall? Like, what is all involved in that? Is it just looking at running? Is there more to it than that? What does that mean to you?
Yeah, so there's definitely more to it than just the running component. As you mentioned, I'm a runner myself. I've been running for competitively for over 20 years now. Started in high school, competed at the Division III level in college at Wisconsin Lutheran College, and that's kind of through that high school and college running experience. That's where my passion and interest in running performance really started. So carried that desire to learn more into my chiropractic education, my postgraduate education. And while putting someone on a treadmill and taking a look at their form and how they run is very important, there's a lot more to it than just that. Going through functional movement screens, so taking a look at how you're able to handle different stresses or different loads in a single leg state, double leg state. Taking a look at range of motion, going through a core assessment. There's a lot of different components to the running analysis beyond just having someone jump on a treadmill and video what their form looks like.
Yeah, I totally agree with that. And a lot of times when I'm seeing runners and doing an assessment on runners, people are surprised that we spend, a decent amount of time before we even get them on a treadmill, because there's so much you can learn about some of those other movements and other functions. And usually, I'm able to predict kind of what I can expect to see on the treadmill based off how they're
100%.
moving how they're moving functionally, and it all ties in really, really well together. So, what are those main functional assessments that you are looking at initially when you have a runner in front of you? What are you trying to what tests are you trying to do? Things of that nature.
Yeah, so one of the first things we do with runners is a squat test. There's just a lot of information that you can gather from that. Taking a look at hip mobility, ankle mobility, um, balance, how well they're moving, if they're shifting to one side or the other. That is probably, I mean, that's where I start with a functional movement test is the squat. That's probably my favorite one. You can gain so much information from that, different areas of the body. It's a really great test for getting a baseline as to how someone moves.
Specifically with that squat, what are some of those movement patterns or necessarily like faulty movement patterns that you're trying to keep an eye on and watch out for that eventually you're going to want to try to correct?
I would say one of the biggest ones, especially with runners, is whether they're able to keep their heels on the ground or they kind of shift all their weight toward the ball of their foot and their heel starts to come up. So that cues me in a lot on ankle mobility, how tight the calves are. And then a lot of times, if they're doing that, their hip joint is staying more over the ball of their foot. And they may even have some hip limitations that they're not able to like sit back into that squat more, that it's almost all knee flexion and very, very little translation of the pelvis backwards as they're sitting down into that squat.
Mm-hmm. Yeah, I find with that too, like it gives you a lot of information on just mobility, like you said, ankle and hip mobility. But it also kind of gives me that initial insight too into like what muscles they like to use. A lot of people like to use their quads
Yes,
overall, and if they don't sit their hips back, I'm like, all right, we need to get those hips activated a little bit more, and we need to get you a little bit more comfortable with what it feels like to actually use those hip muscles a little bit more overall.
for sure. And I mean, that's usually something in addition to like videoing the running analysis. I'll usually video the functional movement screens that I'm going through with people as well. I find a lot of people think they move a lot better than what they actually realize they do once I show them a video of all right, this is what your squat looks like. And they're like, oh my goodness, like I thought I moved a lot better than that. And it can be kind of eye opening, which is really interesting.
And that's part of that learning process too, I find, is like showing people and demonstrating that. I think one thing we talked about a lot about in the last podcast is like motor control and how you're moving. And
Yes,
I think that gives you a lot of key insights into your specific movement pattern and your tendencies. And it kind of helps starting that process of enhancing that overall motor control too.
absolutely. Yeah, I would definitely agree with that.
And another thing that you mentioned that we've talked a lot about on this podcast is the importance of single leg squatting too. And what do
Yes.
you primarily look for with the single leg squatting, and why is that movement pattern so important for you?
Yeah. So a lot of times for like a single leg squatting pattern, I'll have people do what we call a 6-inch step down. So I have a little exercise step in the treatment room. I'll have people stand on one leg and then bring the other heel down to the floor. I find having someone do like an unsupported pistol type squat that's incredibly challenging for a lot of people without some amount of support. So I usually use the 6-inch step down. And again, the big things I'm looking for there are, can you keep your heel down on the step as you're bringing your other leg down? If that heel's coming up or you're shifting toward the ball of your foot, again, the calves are probably tight. You're definitely shifting more toward a quad dominant movement pattern. Um, and then the other big thing I'm looking at is knee valgosity. Like, is that knee starting to collapse or cave in as they're doing that? Again, that's going to cue me into maybe some glute weakness or insufficiency. It's just not firing the way it needs to, even if it's not a true weakness. And like you said before, how you can predict what you're then going to see once you put them on the treadmill. That's usually a pretty good indicator that their knees are either collapsing in while they're running, or there's some other type of gait abnormality that I have a feeling we'll touch on a little bit later here.
Yeah, running is a single leg sport, and it's nothing's going to change that. We're only going to be on one leg at a time. So when we can make
Right.
that single leg squat look as pristine and optimal as possible, we can be pretty confident that when we're in that mid stance, when we're kind of loaded just on one leg, when we're taking that running stride, that that will be as optimal as possible. And I think that's probably a big reason why strength training has been shown to be so impactful for running economy and running efficiency is I think it has more to do than just making the muscle stronger, which absolutely it does. Making those muscles stronger helps, but it also has that big impact on motor control and teaching your body how to move and how to
Yes,
stabilize itself when you're in that one-legged position.
for sure. For sure. Once we get into corrective exercises based on some of those things we find in the movement screen and the gait analysis, a lot of the exercises we're having people do are, single leg or like a Bulgarian split squat or a single leg RDL, like something that is working and training each side independently. That we're doing more unilateral rather than bilateral strength training, especially with our running population.
Hmm. Just out of curiosity, and a lot of the patients and runners that you treat and see, do you find that when you're treating some of these differences in movements, whether it's squatting, double leg squatting, single leg squatting, whatever it is, and you're treating runners, do you tend to focus more on like building full strength and function, or do you tend to focus more on that motor control, quality of movement aspect?
We definitely start with quality of movement and motor control. So I love DNS, dynamic neuromuscular stabilization, which is a mouthful. So we say DNS. It's that really focuses on quality of movement and motor control. How familiar are you with DNS, Matt? Is that something that you've come across?
I'm aware of it, but I don't know
Okay.
very much about it. I haven't delved into it very much myself.
Sure. So I know Peter Attia touches on it quite a bit in his podcast and in his book Outlive, which I was super excited about. It's like, hey, someone popular is talking about DNS. This is awesome.
Great
So
book, by
kind
the
of
way.
yes, it is a great book. If you haven't read it yet, definitely find a audiobook or a hard copy and read it. It's fantastic. Um, so basically the underlying principle of DNS is that no one teaches a baby how to roll over, how to crawl, how to start to stand up. Like those are kind of inborn innate movement patterns. And when we see an issue with a certain area of the body, we can go back to that kind of developmental phase and start to correct what they call joint centration, or kind of how the joint is positioned and moving, and then also muscle activation around the joint. Um, if you're familiar with DNS, a lot of the positions are similar to yoga positions or yoga holds. There's definitely some overlap in those two realms, um, and a lot of it is, once you start to get to the developmental phase where babies are starting to pull themselves up on things, it starts to look a lot like a lunge, or where they're able to stand up in the middle of the floor. It's a deep squat. So there's a lot of correlation there, and I think it translates really nicely for patients that it's like, hey, we're doing these things to help improve the quality of your movement, and then once your quality is good, it's a really natural transition to start to load that movement more, and increase more of the strength component of it.
Hmm. Quality over quantity every time. We need to get that quality component down
Oh yes.
before we start loading it up. And loading is so important in running just because of the
Yeah,
forces. But if we don't have that quality down, then we're going to be loading incorrectly, essentially.
right. And I mean, I think when you look at runners, that's where so many injuries come from, is inappropriate load or too much load in certain muscles. So if you're just loading into a dysfunction, you're probably not going to see a whole lot of improvement, or that's where you end up with some of those chronic injuries that just keep coming back because you're not changing the quality of the movement.
Hmm. Yeah, absolutely. So for the runners that are listening overall, working on those foundational movements, we've talked about like pinpointing and perfecting your double leg squat form, single leg squat form. What other type of assessments or movements do you feel like runners can really, going along with the DNS system, can they work to progress and really try to perfect and optimize their form with?
Yeah, great question. So one of the other big components of DNS is diaphragm breathing, like what your breathing looks like. So basically, the diaphragm, the pelvic floor, and the abdominal wall form a canister that, when pressurized, are going to help support your lumbar spine and kind of be the the foundation point for movement. So the analogy that I like to use is if you have a can of soda, or if you're from outside of Wisconsin, a can of pop. My wife's from Minnesota, so we have that argument all the time if it's soda or pop. But if you have a can of soda that's not opened, that can is pressurized. You can stand on top of that, and it's not going to collapse. Once you pop the tab on top of it, it's no longer pressurized. Drink the soda. If you stand on top of that, it's going to collapse.
Mm-hmm.
Not that your spine is going to collapse per se if your abdominal wall isn't properly pressurized. But taking a look at core function and proper breathing is one of the other big things that we do with runners. So making sure that there is appropriate diaphragm function, that there is appropriate abdominal wall function, and not just the six-pack muscles, but obliques, transverse abdominis, pelvic floor, making sure that all those things are functioning in concert with each other to give you that solid base for distal movement.
Diving into that a little bit more, first starting with like more of the diaphragm breathing, what does that look like overall? Like, how do we know that we're specifically using that diaphragm correctly?
Yeah, so one of the things we'll do to kind of assess for that is in a seated position, we'll have the patient put one hand on their chest and one hand just below their belly button and tell them just to sit there for 15 to 20 seconds and breathe and tell us which hand is moving. Kind of like you said with being able to predict what's going to happen. In a lot of cases, you can kind of predict what that breathing pattern is going to look like. But for a lot of people, it's chest breathing, that every time they take a breath in, their shoulders come up and back down. And that's using all of those accessory muscles of respiration to move the rib cage to get that breath in. Ideally, what we'd like to see with diaphragm breathing, when you breathe in, your abdominal wall should expand 360 degrees around. So your stomach should move out a little bit. The sides of your abdomen should move out a little bit, and even into the back, there should be a little bit of excursion or movement there as well. If someone's struggling with that, we'll have them lay on their back so their spine is supported with knees and hips bent to 90 degrees and their feet up on like an exercise ball or bolster. And then have them breathe in that position, because a lot of times that's an easier position to start to focus on having your hand that's on your belly button move as opposed to the hand that's on your chest.
Great
Does that
explanation.
description make sense?
Yeah, absolutely. Great
All right.
explanation with that. My wife is a physical therapist as well, and she specializes more in the pelvic floor.
All
And
right.
this is one thing that she noticed with me one day. I think I might have been on my bike doing a workout, but I do diaphragm breathe, but primarily it is right at the front of my belly or stomach. And
Yep.
so she's been cueing me a little bit more on like 360 degrees, not just in front, but also the importance of breathing through the sides as well as through the back, which is something that I thought I was doing well with because I was diaphragm breathing. My belly was moving. It
Yeah.
wasn't my chest, but it's also those other components of to the side, to the back, all of that together.
Yes, absolutely. I'm glad she pointed that out for you. It's probably
Yeah,
making you a more efficient runner.
that I'm hoping I've been working on it for sure.
Good, good, good.
In relation, we talked about the diaphragm, but like more in relation to the core,
Mhm.
in and of itself. Like there's so much information that gets thrown around with the core, but like what does optimal core strength and stability look like? Like what should runners be able to do? What should they be able to stabilize in? All of that.
Sure. Um, I think this is older research. I think it was Stu McGill that put it out, um, especially for runners with low back pain, like the ability to hold a plank for 60 to 90 seconds without, your hips dropping toward the floor, or your low back arching. That's still a standard that we use quite a bit. For side planks, I like the 30 to 45-second range. If you're able to do that without losing proper technique, I think that's a pretty good place to be in for most runners.
Awesome. I always like to have this discussion, but a lot of times we think of core and immediately we tend to go to like sit-ups. But really,
Yeah,
your core muscles are not designed to be the prime mover. They're not designed to move ourselves. They're more designed to stabilize and hold. So the right core exercises and activations are going to be those where we're stabilizing and then either in like a plank position, causing some other movement to happen elsewhere.
yeah. How often do you use dead bugs with runners? Are you familiar with that?
I am
Yeah.
familiar with that.
Okay.
I will use them occasionally, especially for someone that we're trying to work up in terms of that core stability. But I do like to train people in those and like trying to keep that back kind of in a neutral position while they're on their back. And for individuals that are kind of visualizing this, on their back and either like Swiss ball in between their knees and their hands, kind of going upwards
Yeah.
towards the ceiling, and then really trying to train people to be able to keep their spine in that position while they either raise opposite arm and leg, whatever it is, because I think that's a really good example of like stabilizing, keeping that back nice and stable, and allowing yourself to move, whether it's at your legs or your hand or whatever it is.
Yeah, I 100% agree with that. That's one, the dead bug and bird dog are two core exercises that we use a lot for runners. Like you said, just to train the stability there with limb movement rather than something like a sit up where, you're moving your trunk, which isn't necessarily what you're looking to do in running or many other activities in life, really.
hmm I really like the dead bug too because I think that helps us remember that the core involves more than the abdominal muscles, but we also
Yeah.
get really good multifidi activation with that one too. Those muscles that sit really deep on the back of our spine. That's a really great one for that one too, which I like to kind of get once again that 360-degree canister. It's not just in one direction, but it's front, side, back, all of that together combined.
Yeah, absolutely. I 100% agree with that. That's one of my favorite core exercises to give to runners. It's a really solid one.
hmm Cool. So we've chatted about double leg squatting, single leg squatting, making sure we're breathing through the diaphragm, all 360, as well as doing some proper core assessments with like planks, dead bugs, bird dogs. What else in terms of functional movement screens are you kind of doing with this overall running assessment?
Yeah, some of the other things we start to check on then are just, which muscles are tight, which ones are not as strong as they should be. So we'll go through some manual muscle testing, just to make sure that from a clinical standpoint, the muscles are strong. Functional movement screening, the other big one we do is a modified Thomas test. So have someone sit toward the end of the treatment table. They're going to bring one knee up toward their chest and kind of give that leg a hug and then lay on their back and let the other leg dangle off the end of the treatment table. Just looking for any hip flexor tightness overactivity, quad tightness overactivity, and then like TFL, IT band with that as well. And that's another one that's really, I think, educational for patients that they're definitely able to tell if one leg is sitting higher up off the table than the other as they go through that test.
Awesome. Out of curiosity too, do you ever test any plyometrics or anything like that?
That is something that I rarely test with runners. Um, More so from a time standpoint, we generally do like an hour running assessment, and that's just something that I guess, chosen not to include in that hour time frame.
Yeah,
Is that something that you
absolutely.
look at quite a bit?
Sometimes, yeah. Things even as simple as like doing a pogo hop or not even like a full jump, but kind of like you're jumping a short jump rope, really low amplitude, high velocity jump. So you're not going very high,
Yeah,
but you're kind of going fast. I like to do it sometimes in double leg, as well as I find sometimes, once again, that single leg assessment will tell me a decent amount if they get on a single leg, even just for 15 seconds and really tend to lean one way or the other. Usually we'll kind of pick that up with a single leg squat too, but that also sometimes will give me a decent amount of information in terms of just their overall stability and trying to stabilize on that one leg with some more force going through.
yeah, I really like that. That's a great insight.
hmm and so I hope by people listening to this, they start to realize like we haven't even chatted about running yet, and so
Right.
it's important to note that there's a lot that goes into that running form, and it's kind of building that foundation. And you can let me know if you have a different perspective on it. And I think that's why it's so important to look at these functional movements because that's kind of essentially the foundation and running is much more dynamic than a lot of these types of things, which means it's
Yeah,
much more of an advanced movement. And if we can't do some of these basic movements, running is going to be a little bit more difficult overall.
for sure.
So we've chatted a lot about these functional foundational movements. Now it's time to finally get on the treadmill, finally, after all this
Finally,
time.
we're finally there.
So when you are assessing that running form, what are you specifically looking out for? What do your eyes kind of follow through a little bit? And we can kind of piece some of these apart a little bit too.
Yeah, sounds good. So the big thing that I'm looking for is what I like to call like the Texas size findings, right? Like what jumps out at me right away as soon as someone is starting to run. Um, I would say some of the big things that tend to, catch my eye right away is if there's a lot of overpronation on one foot or both feet, that maybe they're not in the right shoe type, and that could be contributing to some of their injury history. um, if there's like significant hip drop one side versus the other, and we can jump into what that means and what I'm looking for with that in a little bit here. And then I'd say the third big thing would be like crossover gait, like if their feet are crossing midline as they're running. Those are usually three of the big things that will jump out at me right away, kind of those can't miss it type um, abnormalities in gait.
Yeah, I'm glad that you mentioned the Texas-sized findings because I've worked with in some clinics and things like that where it's like piecing apart little tiny minuscule details of like, oh, your knee isn't bending this much. It's not bending to 40 degrees, it's bending to 35 degrees. We need to change that. And the research doesn't point to that being an effective way to change running form. And we
It
know
does
that there
not.
really isn't an optimal running form. So like I'm
Exactly.
glad that you mentioned those like big findings where it's like, okay, I don't need to go slow motion to see what I'm seeing. I can kind of see that just visually with how you're running and different things of that nature.
Yeah, it's I mean, you can definitely get very nuanced into gait and gait analysis. Um, I think one of my favorite quotes that I've heard, I believe it was from the gait guys, but they said like gait is as individual as a fingerprint. Like no one's gait is exactly the same. And like you said, research does not point to there being an ideal gait. So, trying to change someone's hip extension by 2 degrees or whatever is, um, one, it's going to take all the joy out of running for that individual. And two, it's kind of a waste of time from a clinical standpoint, in
Absolutely,
my
absolutely,
opinion.
absolutely. I'm totally in agreement of that. So let's piece those apart. Let's talk about more specifically like overpronation. What are you looking at in terms of that? I know you mentioned one foot versus the other foot or both of them. What are kind of your key topics around that overpronation?
Yeah, so I guess just to start, I always like to say pronation is not the scourge of the earth. I think some orthotic companies have maybe gotten a bad rap for overemphasizing that. Um, some pronation is natural, like it's part of the body's force dampening mechanism to be able to absorb that ground reactive force. Um, so what I'm really looking for is there overpronation? Like is that individual having to pick their navicular back up off the ground every time they go into the toe off phase? If people aren't really collapsing in a lot, I'm not overly concerned about it. If there's a little bit of inward movement there and one side's a little bit more than the other, um, for the most part, if they're not having injuries with it, we can kind of let that slide. But if there is a lot of overpronation, really seeing a lot of excess stress on the medial side of the ankle from that, that's when we'll start to either discuss getting new shoes, being refit for an appropriate pair of shoe, or working on some foot and ankle stability stuff so that they're able to have a little bit better strength as they're landing on the foot.
hmm I'm glad that you mentioned that too, because I feel like one of the big dangers I find that I don't want any runner or client or patient to fall into is sometimes I feel like people get pushed into more of like stability shoes if they see
Yeah,
just like a little bit of pronation. And it's important to remember pronation is a normal movement of the foot. And sometimes that can be a little bit more negative if we're too much in a stability shoe, just because then it's like it turns off all those muscles in the foot. And we have a lot of
Right.
muscles in the foot that are there for a reason. And so it's also learning how to use those appropriately and not just trying to overstabilize the foot with a shoe or something like that.
Yeah, I 100% agree that you don't want to have the shoe be what's giving you stability as you're running. Like that should be coming from those intrinsic muscles in the foot.
Hmm. But yeah, I mean, it's important to look out for this, especially if someone is dealing with injuries related to that overpronation. For sure, we need to watch
Mhm.
out for it. But one of my favorite pictures is actually, are you familiar with the professional triathlon world?
A little bit, yeah. Not as much as the professional running world, but yes.
Sure. So Patrick Lange is a professional
Yeah.
Ironman triathlete. I believe he's won two Ironman World Championships in the past. Last summer at Challenge Roth, which is a race in Germany, an iron distance race, so 140.6 miles, he set the marathon record, and it was right around like 2 hours and 31 minutes after everything else that day, the swimming and the biking. But
Wow.
there's this really good picture of him in that race, and he's on one foot. He's got massive pronation of the foot he's on, and he's got a massive like hip drop on that one side. And it kind of makes me laugh a little bit because those are often seen as like the danger times, and sometimes when it relates to an injury, it is. But that picture
Yeah.
makes me laugh because that was his record-setting day. So obviously, in some way, somehow, it was kind of working for him.
Right, exactly. And I mean,
Hmm.
I've seen those like similar pictures with um elite track athletes where they're wearing spikes, which are obviously a less supportive shoe than a training shoe, but just massive amounts of overpronation, and they're some of the fastest people in the world. So
Hmm.
that I think that kind of goes to the there's no ideal running form, right? Like they've
Hmm.
obviously found a way to make it work for them, and it's working well.
In some of those individuals, do you do any like specific intrinsic foot training or anything like that to kind of get those muscles within the foot firing a little bit more?
We will. Yep. Some of my favorite things are just getting some toe differentiation going. I mean, I think, shoes are kind of sensory deprivation chambers for our feet, and most of us are in rather rigid shoes for most of the day. Um, so a lot of times, that intrinsic foot stuff is something as simple as, just intentionally with all five toes on the ground, trying to lift just that big toe while keeping the other four toes down. And then can you lift just the other four toes while keeping the big toe down? Um, and working some of that, just kind of matching the mind to the muscle and having better motor control of what's happening in the foot.
Hmm. It's amazing how hard that movement is when you're not used to it,
Oh, insanely
and
hard.
insanely hard. And it takes practice because, like you said, it's putting the mind to the muscles and training that motor control. But it's a good reminder if that movement pattern is difficult for you, likely that communication from the brain to those muscles is not as efficient as we would like to make it. And we can definitely improve that foot stability and the foot mechanics by enhancing that communication overall.
Yeah. And it's not an
Awesome.
easy thing. Like it takes a lot of intentional practice to
Yeah.
to be able to do it.
Whenever I tell a patient, whenever I instruct a patient on that, I always tell them it's not physically challenging, but it's going to be a very frustrating exercise. So just prepare for that.
That's a great way to describe it. You're not going to break a sweat, but you will be frustrated by it.
Yeah. In relation to the hip drop, we kind of mentioned it with talking about Patrick Lange, but what type of things are you watching out for that hip drop or where we're on one foot and the opposite side of the hip kind of comes downwards more?
Yeah. So I think kind of classically it's called the Trendelenburg sign. But that is that contralateral hip drop. So if you're in the stance phase, standing on your right foot, and you hit pause, when your foot is fully in contact with the ground on that video analysis. Ideally, you want your pelvis to be pretty much straight across. If there's any dropping down on that opposite side, so again, if your right foot's on the ground, if that left hip is dropping down, the biggest thing that tells me is that the glute medius on the right side is probably not functioning isometrically to keep your pelvis neutral. And that typically we'll see that same thing with the 6-inch step down. And that's where, knowing or going through those functional movement assessments basically cues you into what you're going to see once you put someone on the treadmill. But working on some glute strengthening, some hip stability stuff is going to be really big with that. That contralateral hip drop, like that can be an indicator of some injuries, whether it's like an IT band syndrome or something like that, because there's other muscles trying to compensate. But the other big thing is that it's just an energy leak. Like it's not the most efficient way to move forward. Basically, I tell people, if you think of running as like being a perpetually falling forward motion where you catch yourself, if you have that hip drop, it means you're starting to deviate out of the sagittal plane and into that frontal plane. And you're losing energy and efficiency as you do that.
Mm-hmm. Really good points, and you kind of took my thoughts out of my head when you were kind of relating the functional assessments we already did with running, because you're right. A lot of times you'll see that faulty movement pattern with that like single leg squat where that knee's falling in or that hips shifting to compensate for that. And I find that relates a lot to that mid stance position of running when we're just on that one foot. So what are some of the like more corrective exercises or activation exercises that you like to use to really make sure we're as resilient and robust as possible in that mid stance position where we're just on that one leg?
So I mean, starting really basic. I like something just as simple as like a side lying leg lift. So laying on one side, kind of with your back up against a wall, keep the heel pressed back against the wall and lift that top leg up without letting your leg deviate forward. That or drift forward at all. That keeps good glute activation, the driving the heel back into the wall as you lift up. From there, we'll usually go to like a clamshell or a side plank clamshell with a resistance band around the knees. If the individual is able to progress to like a side plank with a leg lift, so right side down, left leg lifted up in the air, as long as they're not dropping down toward the floor as they do that, as long as they can keep a solid torso and pelvic region, that'll be one that we'll go to a lot. And then kind of I guess the end step of that would be like a single leg RDL. And then starting to load that single leg RDL where you have to have that single leg stability, like the single leg stance phase of running, and we're getting that glute and hamstring activation that we're looking for.
Awesome. Yeah, it's all training, kind of going along that progression that you said. It's all training that single leg position appropriately so that when we get into that position with running, we have that motor control and coordination to appropriately activate those muscles overall.
Yeah, definitely true.
One
From there we can either progress or regress as we need to for where the individual runner is at.
One thing I always like to do for that in particular is to just get people on that one leg and have them kind of get into like that ready stance where they're just bending that knee on one leg. And I find a lot of times that's where you can see some of that quad dominance too, where just that knee bends and goes forward. And
Oh
so a
yeah,
lot of it is training people to kind of what we call a posterior weight shift, or trying to push your hips backwards to kind of balance that out a little bit and activate some more of those hip and glute muscles a little bit. I find that to be really effective for individuals too.
I really like that. That's great. What other exercises are your kind of go-tos for correcting that hip drop?
One of my go-tos is I call it the runner's pose. I'm not sure if it's noted as something else somewhere. Exercise names are a little weird, but I have them essentially with a Swiss ball or a big like yoga ball against the wall against their knee. And I have them try to attain that. Let's just say that ball is against the right leg against the wall. On the left side, I will have them kind of attain that ready stance where they're kind of pushing their hips backwards and getting into that knee bent position. and then the left leg is just stabilizing, and then the right leg is rolling that ball up and down, kind of like a runner's pose of like lifting that knee up and
Yeah,
down. I find that's a really good one to get a really good burn in that outside of the hip on the left side that you're standing on, really trying to activate that glute med, as you mentioned, and kind of activating and getting that motor control down to remind the brain and the nerves to activate that muscle specifically when you're in that stance position.
that's a great one. And that like really focuses on that single leg stance phase too, that, we've been talking about the importance of the single leg versus, bilateral. That's a fantastic exercise. I really like that one.
It's
I'm going to steal
also
that from you.
it's also nice to progress that into a single leg squat as well, of like really trying to push the hips back with that ball against the wall. It is probably my favorite single leg squat variation because usually with single leg squats, you'll feel it in the quads, you'll feel a little bit in the glute, but like with that variation, you feel it exactly in the glute med.
I love it. That's great.
I like to tell people when they're doing that exercise, you don't need an anatomy lesson to know where the glute med is when you're doing that one.
That's awesome. Love it.
How about then the third Texas size finding, that crossover gait? What are you specifically looking for with that one?
Yeah. So, I find that that can be something that will sometimes be a little bit more prevalent on a treadmill than it would be outside. Like you just have a little bit of a narrower belt that you're running on with a treadmill, and some people like to keep their feet a little bit closer together. Um, so again, kind of similar to what I said with the overpronation. If the foot's getting close to midline, I'm not overly concerned about that. But on the video, a lot of times what I'll do is just draw a line straight down the middle of right down the spine, all the way down between the feet. And if the foot is crossing all the way over that line, or a majority of the foot is crossing that line, that's where we'll start to do more with that. Um, a lot of times I find that that correlates to glute medius weakness as well. Kind of going back to what I said with the hip drop, that you're starting to deviate into that frontal plane and out of the sagittal plane. Um, a lot of times it's the same thing with that crossover gait, that you'll see maybe a very slight amount of hip drop, and not enough that that's the main finding. But when you hit pause on the video, you can see there's a little bit of hip drop there. The pelvis starts to deviate into the frontal plane, and then you bring your foot back across midline to kind of bring yourself back upright. And it sort of becomes a self-perpetuating thing where it's almost like your hips are swaying side to side more than they should. So you're bringing that foot across midline to keep yourself going forward rather than moving side to side.
Mm-hmm.
Sometimes there can be a core trunk stability issue with that as well. But that's one where I'll do the side plank clamshell a lot, or the side plank with the leg lift, because then we're getting both glute medius as well as obliques, transverse abdominis involvement, that it's both core and glutes at that point.
Awesome. Yeah, that's a good explanation of it too. Do you ever find with that crossover gait, if it sometimes relates to, like, let's say if you're doing your initial assessments of range of motion, do you find ever that that crossover gait sometimes relates to hip stiffness or hip joint mobility as well?
Yes. Yep. That's a really good point. We didn't even talk about assessing range of motion at all, but that's definitely part of it as well. And yes, I find that quite often, that especially if there's limited mobility both in internal and external rotation at the hip, that's where a lot of that crossover gait will start to show up in the running assessment.
Mm-hmm. It's always that combination of like, what's our mobility, range of motion combined with our strength. It's not one side more than the other, but it's how both of those kind of connect and interact with each other a little bit.
Yeah, absolutely. It's like
Just
two
out of
weights on a scale, right? That has to be balanced out. Otherwise, you're going to end up with issues.
Yeah, absolutely. And that's what we're trying to avoid by doing some of these running analyses and things of that nature. Um, Now, let's say, just out of curiosity too, like let's say you bring somebody through this whole assessment and we find some, impairments with their functional assessments with like squatting and core, different things of that nature. We find some of those similar things with running as well. What is kind of your first go-to to kind of help that individual and kind of correct some of those issues? Is it stuff that they're doing to change their running form on the treadmill? Is it more corrective exercises like we've talking through? Do you start with the functional assessment or you start more with the running?
I tend to start more with the functional assessment. I think, and I don't know that there's necessarily research to back this up. This is more just my opinion. But I think trying to get people to correct their form on the treadmill seems to lead to a lot of frustration. And again, just kind of taking the joy out of running. I think if you ask most runners, they would admit that there's as much of a mental health benefit to running as there is to or as there is physical. And once you start having them focus on fixing specific things in their form, it just kind of loses some of its luster, I guess. So I usually start with the assessment, some of the things I found in the assessment, corrective exercises, strengthening there. And then the other thing we incorporate a lot is form running drills. So based on what their dysfunction is, having them take, 2 or 3 minutes where they're going through a form running drill to work on that proper running technique, but not while they're running, if that
Hmm.
makes sense.
Yeah, absolutely. It's
How's
getting
that?
those.
How's that compare to your approach?
Yeah, that's my approach too, because I find that, like you said, it's frustrating to change and get nitpicky with running. And I just don't find it to be super effective because your body just, it self-optimizes its running form. And if we're trying to focus on one specific thing while running, usually I find that it doesn't work super well. But by working on some of those functional movements, squatting, single leg squatting, core, we can sometimes make some dramatic improvements with how the body is able to tolerate running and tolerate that overall run form without even touching their running form overall. Because I think it sometimes can get a little bit dicey if we play too much with specific running form overall.
Yeah, I absolutely agree. That's definitely been my experience as well.
Hmm. And it's interesting too, because again, this is kind of like the big theme of the last couple of podcasts. It relates to this idea of like motor control. And I always give the example of like a baby giraffe trying to learn to walk. They don't have motor control. Like they don't know how to like coordinate their limbs. And motor control is like finding out how to like activate those specific muscles, teaching those muscles how to activate appropriately. And there is some good research out there that like strength training on its own doesn't necessarily change run form, but a
Mhm.
big component of outside of strength training is that motor control and teaching the body how to move. And I think that can have a very big impact on running form outside of just regular strength and building strength in muscles.
Yeah, I think that's very true. And that's where I like the form running drills, like using that time to focus on some of that motor control and that proper technique. Taking that strength that you gain from the corrective exercises or strength training and starting to integrate that into what your running form looks like and what feels natural and normal. And
Awesome.
yeah,
Does this approach with like clients that come into you, patients that you treat, does it surprise them very often of like, I thought we were going to work on my running, but why are we working on those types of things? Does that surprise people often for you?
yes, it definitely does. And I think quite possibly more so because I'm a chiropractor and not a physical therapist that, it's like, oh, we're looking at more than the spine. All right. This is different. But yeah, it definitely does. And then I think there's a fair amount of, I guess I'll call it fear or apprehension in the running community that anytime you go to a doctor, like they're going to tell you to stop running, right? Like, well, if it hurts, just don't do it kind of mentality. Um, and that's something that I try my best to avoid. If at all possible, I want athletes, runners to stay in their activity. It may mean scaling back a little bit or decreasing, volume or load. Um, but to be able to at least get out for some amount of running a couple days a week while we're working on some of the strengthening things. And if the injury is not significant, a lot of times we're not reducing the injury at all. We're just working on some of the soft tissue injuries or tendinopathies or whatever while doing strengthening stuff and still keeping them in their activity. And I think
Yeah.
that surprises people as well. But I think, athletes appreciate that approach.
I'm really glad that you brought that up. And that's why I think it's one of those things that's so valuable and beneficial to see providers that specialize in running more, just like yourself, because you have a different point of view of running than a lot of other clinicians do. And so you're able to piece it apart and really determine if the injury is so much that we actually do need to step away from running in like the case of like a bone stress injury or something like that, or
For sure.
how to appropriately modify so that we can still keep training and keep running while addressing these other components. And that's why I think it's so important to find somebody like yourself at Elite Sport and Spine that you can trust. And hey, when I go see Dr. Zach Shiels, he's going to give me the best assessment possible related to running specifically in order to stay running and to stay running healthy as much as possible.
Yeah, and that's why I love having conversations like this with other like-minded providers like yourself, Matt. I mean, um, this has been great.
Awesome. And yeah, I greatly appreciate it. And I hope that people listening kind of understand like there's so much more than just running that goes into a running assessment. And I'm glad that we're able to kind of open the curtain behind that a little bit more and kind of relay kind of what we're specifically looking at when it comes to running, when it comes to functional movements, just kind of provide as much education as possible. So I appreciate that. Anything else to add at all, Dr. Shields?
I don't think so. We covered a lot of ground today. This was great.
We did. What races do you have coming up this year? Are you training for anything in particular at all?
I am. I am doing the Milwaukee Marathon on, I believe it's April 13th. So as we're recording this podcast, I'm in the peak of my marathon training volume right now. I have a 20 miler on the schedule for tomorrow morning, so that'll be fun. Um,
Awesome.
and then beyond that, I'm not 100% sure. Um,
Cool.
I may do a fall marathon. I did some duathlons last year, which was a first for me. I really enjoyed combining the biking and the running. So um, I don't know. We'll see how the marathon goes, I guess. And if it goes well, there may be more marathons in the near future. And if it doesn't, then I might shift my focus again. Who knows? We'll see where that goes.
I get accused sometimes of trying to drag people into the dark side of triathlon world, instead of just straight up running. So I hear you about the duathlon. Sometimes it is nice
I
to kind of
don't.
go back and forth with it a little bit.
I'm not a swimmer. I'm not a fan of the water. I'll just stay on dry land.
That sounds good. Do you, if you want to go ahead, Dr. Shields, and share where people can find you, social media, Elite Sport and Spine, all of that good information so that people can find you?
Yeah, absolutely. So the clinic website is elitesportandspinewi.com. Our Instagram handle is ESS Brookfield. And then my personal Instagram account is running_Chiro, CHIRO. Um, those are the best places to find us. We have a YouTube channel as well with a lot of the corrective exercises and form running drills that I discussed today on there. That's Elite Sport and Spine WI as well on YouTube. So yeah, those are the places to find us and see some of those videos if our verbal description didn't quite click with you or didn't quite make sense.
Yeah, that sounds great. And I will make sure to include the show in the show notes, links to all of those things. I'll include show notes to YouTube video, and maybe I'll try to piece apart some of those other more specific drills that we chatted about and include the links to those as well, because I'm a visual person. I don't necessarily understand as much from like the verbal perspective. So that way people can get eyes on the exercises and kind of understand it a little bit more in detail overall.
Yeah, that's the beauty of the show notes, right? You can include all those links in there. So thank you very much for doing that. I appreciate it.
Yeah, you bet. Well, thank you once again for coming on the show, Dr. Zach. I greatly appreciate it. And take care, everyone, and happy training.